Overall, it was a pretty great experience. It was pretty eye-opening into the medical field. I learned where my interests lie. I also learned what I didn't like as much. I thought that was pretty good. A lot of exposure to just medical care professionals in general, just a lot of the day-to-day, what they do to the day-to-day basis.
During the different experiences that I had, I was able to learn a lot of knowledge and talk to a lot of people. And so it definitely enlightened me into my experience, as well as like different careers that I was kind of looking into but didn't have a lot of experience with, and was just able to learn so much from the doctors as well as the patients. So it was a very amazing experience and I was very enlightened.
Since I was a high school senior during this program, it was definitely fresh air for me, because I mean, a lot of my friends from high school don't really get to interact with doctors and patients one-on-one, so this was like a really nice thing to do.
I kind of went in knowing what I wanted to do, which was labor and delivery nurse, and I actually got to meet with a midwife, and I rotated with her one day, and I really liked it. It caused me to kind of research more into midwife and what they do, so I've kind of been leaning on that, so it's kind of helped me a little with my career decision.
Personally, as a minority female, I was very grateful to have been able to have the opportunity to shadow with some of the different physicians. I learned a lot about myself, I learned a lot about my community and the lack thereof of diversity within healthcare around my community.
There was a lot more, I would say. Electronic use that I didn't know. I thought it was just go, go, go all the time, but really sitting down with the doctors, you really have to make sure you read before you go enter into a patient's room, or just like seeing everything from behind the scenes and how much work actually goes into it instead of just walking in and saying, hi, I'm gonna take care of you, was very eye-opening to me. So yeah.
I actually loved the internship. I know it was cut short due to COVID, but everything surrounding it, the people, connections, all the workshops we had, it was a great opportunity to really get in our community and just learn more about the medical field.
We definitely talked about how there's a need for Black psychiatrists, because sometimes in the communities when you don't have a lot of Black influences, you're not able to relate on certain issues, and you might not feel comfortable with talking about those issues if you don't feel like they go through the similar things. So being a Black psychiatrist, I just want to show that mental health should not have a stigma to it. Everyone needs to deal with their mental health, and everyone needs someone to say like it's okay to talk about some of your issues. So I just want to be that person that's here to listen to you as well as help you with everything that you need within your mental health. So
I just thought the whole experience was cool, like being able to sit in with a doctor and the patient just one-on-one, and like I'm wearing a lab coat and stuff like that, and most of the patients think I'm a doctor too, so it's actually pretty cool.
I really almost got emotional when I went to go see palliative care with this doctor, because it's helping them with the end of their lives, and just knowing like the connection that they have, setting them off into heaven or wherever they are going to go.
I think the most interesting experience I had throughout my internship was definitely right across the street at the Mayheck dentist office. I got to watch a tooth extraction for an older man who was hoping to get dentures. So he had a tooth that was like up in his gums that had to come out in order for the dentures to properly fit. And so the doctors had to go in and, extract the tooth. So watching them use the scalpel and everything, and all the force that it took to, manipulate the tooth out of there, that was a pretty awesome experience. Blood was flowing, and I thought it was pretty unique, pretty awesome to watch. So
I actually had it palliative care over at Mission, and it was just really eye-opening, just the experiences and how like life works, and like patients when they're close to the end of their life. And so it's really getting that center and like more like relationship with the patient and their family. So I think that was really my aha moment of like why I want to go in the medical field, and I think it's just caring for others and really being sympathetic towards them, but also providing that care that they need.
One of the most interesting experiences that I was able to witness during this internship was seeing a patient at the dermatology center get a chunk of his face cut out. It was very gross, but it was interesting to know that there was no pain involved for him, although it looked very painful. The dermatologist did a really great job numbing it, and he did a great job explaining to me why that particular procedure was being done. I learned that a multitude of their patients come from Florida and they have skin cancer. So in an effort to cure that, they have to do removal of skin sometimes.
I had a rotation at OB with Dr. Mycini, but she didn't have anything interesting that day, so she'd put me with another doctor, I can't remember her name, and she did a leap on, I think she was like 40 years old. And I got to see the whole thing, and I got to see how they did the whole procedure, and I got to talk to the patient. It was really cool. I really liked it.
Yeah, so what surprised me most about the internship was definitely COVID. I'm currently in a medical internship, and halfway through it we have one of the biggest pandemics of my life, and I think through a lot of people's lives. So it was really interesting seeing how that pandemic played a role in the same offices that I was participating.
During COVID, I know we still had that first week before school let out. We were still practicing. I was actually still at the hospital like a week before we got out. We were taking the same precautions they were doing, the PPE, depending on like cases, and then also a lot of hand washing, hand sanitizer. But unfortunately, once COVID came around and our school got cut short, we didn't continue our internship for this year.
Well, personally, I had the opportunity of doing this my first semester, so I was completely done before this pandemic occurred. However, if I were to have taken this internship this semester, it would have given me a great topic to speak about. It made me become more aware of like public health and situations such as those in my community.
It was definitely something in the air, like when it first started. We were all just kind of like, oh, like what would happen? And then like I remember the very last day that when I had my rotation with the midwife, that was the day that had a meeting about all of it, and apparently my counselor was like, we can't have you guys go there anymore, and it's like completely off. And it was very, at that point, I felt like it was very like, it was like, oh wow, this is really real, you know, I can't go back. And it was kind of like disappointing because there was a lot more. We had a little calendar where she kept everything scheduled, and there was a lot more interesting things. That's when we were gonna start at the mission rotations. So that's when it was gonna be like super cool, and we're gonna learn super cool stuff, and then it just kind of got taken away.
It was the short time we had with Dr. Frayne at the very beginning, like before we even started our internship, and I think we didn't get to like actually follow him. I think that was in the upcoming weeks after all of COVID, but I think his background story of how he got into the medical field and how that really pushed him to further himself was really like interesting to me, because I've never really heard anybody say like, oh, I didn't want to go to school after high school, like that wasn't my plan, but after this situation with this person, that helped me evolve and realize that, oh, I can make it here, and this is something I want to do for the rest of my life.
So the one doctor that stands out the most to me is Dr. Nicholas Wilkinson. He's the first doctor that I met in this program, and he actually works here at Mayheck, and he's a resident. What stood out to me the most from him was basically he was a resident, so he was kind of new to the whole thing about being a doctor. But if I was him, I would have been scared to be a resident, but he showed me that there's someone you can always go to. So there was a doctor that was above him that would teach him stuff that he needs or things that he didn't know. And he always looked back on his laptop for notes and stuff like that. So there's always an out, I guess.
Dr. Bernstein is just amazing. Like she even comes to like my job, we go get cupcakes and stuff. And then Dale Fell, he's also just so amazing. He's so like genuine. And like I just love genuine people, and just to see that in the medical field with all the stress and emotional stress you can get, to see them still care was really amazing.
I really enjoyed Dale Fell. Dr. Dowling, he was an amazing person as well as a doctor. I enjoyed it because it wasn't just a name basis type of relationship. It really was that he cared about his patients and that he wanted to see them succeed, whether that was coming off of drugs or just working through their situations. It was very enlightening, and I really enjoyed my experience throughout that, yes.
Dr. Caroline Knox from Missions Palliative Healthcare, she definitely inspired me. Her demeanor, her amount of compassion for the patients and their families who she was, looking out for. It made me become even more empathetic, and to realize that, although this is a difficult time in someone's lives, she dealt with it really well, and her sense of compassion, it allowed me to see that you need that in healthcare, especially in the field that she was working in?
Okay, I definitely feel like Dr. Atkinson. I felt a connection with him. I really liked how he taught me like I was a student, and for like with other rotations, it kind of felt like I was just like looking and I was just watching and I was just listening, but he really showed me everything. He really showed me the details with the computer, and he would actually stop with his patients, he would stop and explain stuff just to me, just so I can make sure, just so he can make sure that I was like paying attention and I was learning with him.
I'd like to thank Miss Jacqueline and Miss Tracy for even giving me the opportunity, for accepting me in and being such good mentors to me throughout this whole thing. I would like to thank my fall interns, Iva and Cedra, for becoming some of my best friends and motivating me, even with like changing up things, going to college, going through the whole college process together. Like we did that all together, now we're all going to the schools. I'd like to thank all of my teachers that pushed me into doing the program, especially Ms. Bryan and Ms. Dyer, always having me in, making sure like my CNA stuff was good at school, and also to my family, because without them, I wouldn't even be here today. So
Definitely Miss Hallam and Miss Tracy. They definitely helped me through a lot of things. And they were always here for me if I ever had any troubles.
I would definitely like to thank Ms. Hallam and Ms. Tracy for providing us with this opportunity. I'd also like to thank all of the physicians who warmly welcomed us into their office and showed us the ropes a little bit.
Miss Jacqueline Hallam, Miss Tracy Ashby Wagner, and the whole MAHEC facility team who I had the opportunity to work with, all of the doctors and residents I had the opportunity to shadow, and whoever makes this whole internship possible, a big thank you, because without it I would not have had the knowledge that I have now, and I have a greater sense of myself and what I would like to do in my future.
I'd like to thank Ms. Hallam and Ms. Tracy. They really put the whole thing together, and they were very organized, and it really made the whole process super smooth, and they're really just the big bosses behind this whole thing, and they really made it work, and I'm super thankful for them, so thank you.
I'm so grateful to Ms. Hallam as well as Ms. Tracy. They were very helpful throughout this process. Sometimes I wasn't able to come due to sickness or things of that nature, and they were very caring and knew that it was okay and that I could be able to learn so much more if I was like feeling better and took that day off to get over my sickness and coming back positive again and just ready to learn more. So thank you all to Ms. Hallam and Ms. Tracy again. Thank you.
Yes, I want to give a special thank you to both Miss Hallam and Miss Tracy. I know they're the two main people that get all this together and really help make this happen. I know it got cut short once again, but even that time what we had with them and throughout the semester, they've always gone the extra step to even support us outside of our internship and really get to know us better as people. So thank you guys. This couldn't have been done without you, and just can't wait to see what we all have in store for us after this.
it seems like they're doing their job. At the end of the day, they're gonna make sure you're okay, and they're gonna do everything they can, and they can do everything they can to make sure you're okay. At the end of the day, I should probably redo that one. It's okay.
Which doctor inspired you the most and why they inspired you?
What if I don't remember their name?
Oh man. A little bit about your experience with the internship.
So each day I would drive, well, can we start over?
Sure.
Thank you. I don't need to put all that in there.
What do you feel like your experience was with the minority medical mentoring program?
Well, my experience.
It's all right. It's okay. It's all right. All right. When did you start the program?
I really want to start.
Truthfully, I want to thank all of the doctors who allowed me to in their offices to intern with them. They each inspired me and showed me a glimpse of my future. They each empowered me and allowed me, one more time. Gosh, please. Okay, I gotta fix my last part.
Okay, go ahead.
Okay, truthfully, I want to thank all of the physicians who allowed me in their office to shadow. They each Come on, come on, come on, come on. I think moving forward, this internship has really helped me. I'm just blabbing. We gotta restart.
This internship has changed my views on medicine as a whole due to the fact that, I really did not know all that much about medicine and what type of fields there were, but now I know there's so many different types of fields of medicine, specifically like integrative medicine, cardiology, sports medicine, palliative care, just different things like that have really just broadened my knowledge, and it's really an amazing thing what medicine is. I was most intrigued with the opportunity to see a 38mm stent being placed into the heart. Most of the time, cardiologists only do like a 30mm stent or 28, somewhere around there. But being as young as I am and actually being able to see the 38mm stent being placed in was amazing, just amazing. Now more than ever, I am very passionate about helping others, whether it's providing rehabilitation or orthopedics, cardiology, integrative medicine, just being able to help others who need help, because that's my goal in life, is to be able to provide the care that others need.
My name is Brianna Williams. I go to Asheville High. I am a senior. I plan to go to UNC Greensboro and become a pediatrician. I want to major in human development and have the pre-med prerequisites and path. The awards I have received are from the Community Foundation, and that is all. I'm waiting to hear back from a lot of awards, and I will keep you updated as soon as I hear back. A doctor that inspired me the most would be Dr. Caldwell, because when I was there, he had a great interaction with his patients, and he prayed a lot with them, and he just saw them through their problems. He knew that they could get through it without, medicines and stuff like that. He's a very religious person, and I believe in God also, so it just touched me to see how he interacted with his patients, and he prayed with some of his patients if they were believers of Christianity, and he just was such a great influence on me, because he just had that great interaction with them. This internship has aided me and just allowed me to see what it takes to become a doctor. It takes many years, but you need that push and that encouragement to get there, that motivation. And I know through this internship I have that with my mentors, and also through Miss Jacqueline Hallam. She has encouraged all of us, and she has encouraged me, and because I've known her for so long, I know she will always be there to support me.
I wanted to do the MMMP program because I felt that I already have an interest in the healthcare field. I originally wanted to be a pediatrician, and I felt as if the MMMP program would help me figure out if there were other avenues that I could go through. And also I felt as if the MMMP program was a great experience not only for promoting diversity in healthcare, but also having good experiences throughout the Western North Carolina. I felt as if my wow moment in the internship was whenever I was shadowing with Dr. Doris in the dermatology, because he sees some patients who have a lot of different skin conditions, and then something that kind of snapped in my head was seeing a little boy who had tons of warts and a bunch of his conditions in his skin that he had to treat. And not only did that stick with me sort of, I felt as if that since it can happen to anybody. It can happen to a child, it can happen to an adult, it can happen to someone who's 75. It can happen to anyone in the world, and it's up to the doctors and people to take care of that. So without this experience, I would have never figured out half the stuff I know today, because I feel as if the MMP program really gave me some important tools that I needed, and also I feel as if that it's really surprising how doctors are so open and want to teach and help other people that might not be on their same level of education, but they're willing to teach and help people who want to become doctors.